and others also demonstrate that there is less morbidity and more safety associated with vaginal hysterectomy in undescended uterus as compared to abdominal or laparoscopic assisted vaginal hysterectomy. These studies have been conducted by Shah, Sheetal and Chahana in India and at various places at Bangladesh also in England. Our intervention using 2 clamps is the most minimally invasive of all. We conclude that for benign uterine diseases in selected patients in undescended uterus, 2-clamp vaginal hysterectomy is the most minimally invasive treatment option with shorter operative time and hospital stay and minimal blood loss and post-operative complications. So it is recommended that it should be performed whenever possible, and gynecologists should maintain their training and competence in vaginal hysterectomy. That was the video. Please help. Please help. So that is the procedure. It takes hardly 30 minutes. Rather, in some cases it lasted 20 minutes. The bladder is being dissected with a few strokes of scissors, and the pouch of Douglas is, the uterine pouch is being opened. In the same way, the pouch of Douglas is being opened. The speculum has been inserted, and the first clamp is being applied, which includes cardinal and intersector ligament along with uterine vessels. It has been cut and ligated. So the same procedure on the opposite side. Both the cardinal and intersector ligaments. These have been clamped, cut and ligated. And you see the blood loss is minimal with this approach. But that is particularly in undescended uterus. The fundus has been delivered, and the second clamp is being applied, which includes ovarian pedicle and the round ligament. These have been cut and these are being ligated. So the same procedure on the opposite side. That takes hardly the wart is being closed and transversation giving support. It is, our thesis is it is much more convenient and cost effective in developing countries, just like ours. The hospital charges and cost are minimal with this approach. So it should be practiced in our hospital. Thank you.